On this first day of the new year, we start with more of what we saw in 2020, the coronavirus pandemic surging across the country. The U.S. now topping 20 million cases just 4 days after surpassing the 19 million mark. So if you didn't catch that, I'm going to repeat it again because the numbers here are staggering. 4 days, another 1 million Americans infected. And as we start the new year, there are nearly 347,000 Americans no longer with us because of this virus. And another case of that more contagious strain from the United Kingdom is here in the U.S., this time in Florida. So far, this new mutated variant popping up in at least 3 states, although experts say it doesn't appear to be more deadly. We do have some hope, though, in the form of vaccines. But the problem is the rollout is slow. Less than 3 million Americans have gotten their first shots of either Pfizer or Moderna's COVID-19 vaccine so far. Nowhere close to Operation Warp Speed's goal of distributing 20 million doses by yesterday. And if we don't pick up the pace, vaccines could go bad before they even get off the freezer shelves. NBC News correspondent Ron Allen joins me now. Ron, New York City was once considered the epicenter of this pandemic. Now it's looking to speed up the vaccination process. So where are they now? What's the plan, and how many vaccinations are happening in the city on a daily basis?
Well, in New York, the numbers are better, but they're still, like in the rest of the country and other parts of the country, there's only a small percentage of the vaccine that's been distributed by the federal government that has actually been administered by the city. There's still these bottlenecks in the system. Here in New York City, the mayor has announced this bold New Year's Eve plan, this resolution, I should say, this New Year's resolution, to administer 1 million dosages during the month of January. That sounds incredible. He, of course, is saying that they need a lot of help from the state and federal government's money to get this done. But it speaks to the dire need to get vaccinations done in a place like New York, where there has been such hardship. Will it happen? It's unclear. But across the country, there is a push to get this vaccine process moving much more smoothly. There are a lot of bottlenecks. There are places where there are staff shortages. There are places where the vaccine just isn't getting out of the door as quickly as a lot of public health experts and a lot of others want it to. So that's where we are right now. Simone?
As you mentioned, there are states around the country that are really struggling with the volume of vaccines. Let's talk about Arizona, for example, where we're learning that 4 out of 5 doses that arrived in the state this week had not been used. What are some additional reasons behind why this is happening there? You mentioned staff shortages, Ron.
Well, the problem is budgets. State and local health departments have had their budgets cut over the years, and this year they have, of course, undergone all kinds of challenges trying to deal with the pandemic that's been plaguing the country. And now the latest chapter, trying to get vaccines distributed. Before it was testing, and those lean budgets, that lack of resources, is what so many states are saying is the problem with getting the vaccines out. They want more help from the federal government. We've heard that so many times before. The federal government's pointing the finger back, at least the Trump administration is. It'll be interesting to see, and the hope is that the Biden administration incoming will take a more aggressive approach to trying to help cities, states, local authorities, local health authorities get this vaccine distribution process moving much more quickly than it has been. Simone?
And this is some troubling news that probably the Biden or Trump administration could not have seen coming out of Wisconsin, where a hospital worker is accused of intentionally ruining hundreds of vaccine doses. Can you tell us any more about what happened there?
Well, it's a criminal matter, as you might imagine. This individual, his identity is not clear. His motives are not known. Apparently, he allegedly left out some of the vaccine that needed to be refrigerated, and it spoiled. Unclear why anyone would do such a horrific thing at a time like this. It appears, however, the good news, if there is any in all of this, is that there were some 57 people or more who were injected with these vaccines, and the manufacturers and others are saying that no harm should come to them. The vaccine will not be effective, and they have to be redosed, but it shouldn't be harmful to them. That's the good news, if there is any of this. But what this individual's motives were, Why he did it, allegedly, it's really unclear. But it's an example of the kinds of things that have been happening around the country, the snags, the long lines, the rocky road that this rollout has really been going down. The numbers are nowhere near the 20 million that the Trump administration predicted and set as a goal for the end of the year to have people vaccinated. We're down in the near 3 million. And a lot of the vaccine is sitting on shelves because it's not possible, it's not efficient, it's not able for local health authorities to get this out to people who need it and want it. So again, as we begin the new year, a lot of challenges ahead. Simone?
Yeah, it's to put it lightly, it's disappointing to hear that we are having trouble actually rolling out the vaccines. I mean, it doesn't matter that we had an extremely fast timeline in producing them if they don't actually get into people's arms. So let's pivot now and talk about new CDC predictions that are not good, estimating the U.S. could reach well over 400,000 deaths by the end of this month. Another issue that this country is facing is capacity in hospitals in states all over the country. Can you tell us more about where we stand right now as a nation and what we could potentially be looking at in the months ahead?
Well, you've spelled out the predictions, the forecast. The numbers are ever increasing, it seems. In places like California, the hospital situation is in Los Angeles County. In particular, the hospital situation is particularly dire. There's just overcrowding there, and a lot of other places around the country. There's also this new strain that has been detected of the virus that was first detected in the UK, and it's now in at least 3 U.S. states: Florida, California, and Colorado. And while the strain is not more deadly, it doesn't make people sicker, it does apparently spread more readily. So that, many think, is going to contribute to the numbers going up. The good news on that front, however, is that the vaccines do seem to be effective against that new strain as the strains that we've been more familiar with. So there's that. But again, we go back to the same problem of the vaccinations not happening as quickly as need be and as quickly as so many people want this to happen to fight back this virus. So again, now as we enter the post-holiday phase where so many millions of people have defied the public health warnings and pleas not to travel and visit with and spend time with loved ones in small family groupings, the fear is that the numbers are going to increase and that there could be a couple of very dark months ahead, bleak months ahead, before we get to the point where millions of people are vaccinated against the coronavirus. And hopefully by the spring, summer, which is the predictions now, when there will be widespread vaccinations, that we'll be able to beat this thing back and save lives, save more lives. Simone?
New year, same problems. Thank you so much for this comprehensive look at the COVID-19 pandemic across the country, Ron.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.